Hi, I'm Beth Badalino, CEO of Healthy Women. And on behalf of Healthy Women and the Black Women's Health Imperative, I'd like to welcome you to the latest webinar in our Reclaim Your Wellness series. Today, we're focused on understanding the connection between obesity and mental health. A joint international consensus statement for ending stigma of obesity pointed out that among adults with obesity, the prevalence of weight discrimination is 19 to 42%, with higher rates among women compared with men. Weight stigma is associated with depressive symptoms, higher anxiety levels, lower self-esteem, social isolation, substance use, unhealthy eating, and weight control behaviors such as binge eating and emotional overeating. For people of color, our studies have shown that chronic stress can make the problem even worse. It's something we at Healthy Women hear, see, and read about often. And for the millions of women who visit our site each month, we want to ensure that we're providing them with the resources and education that they need to make informed choices about their health and their well-being. This webinar helps us to honor National Minority Mental Health Awareness Month, observed each July to bring awareness to the unique struggles that the racial and ethnic minority communities face regarding mental illness in the United States. It reminds us that we must have conversations like we're having today if we're going to change society's damaging perceptions of people living with obesity. And we want this conversation to include you. So please ask questions using the Q&A function. And before we begin, I would like to recognize NAMI, the National Alliance on Mental Illness, for their collaboration on today's webinar. NAMI is the national largest grassroots mental health organization, helping to create a world where all people affected by mental illness can experience hope, recovery, wellness, and freedom from stigma. I also want to thank Novo Nordisk for their support in helping us bring this important topic to life. And now, I'm happy to introduce today's moderator, Leslie Foster. Leslie is an award-winning journalist and mainstay of Washington News as a weeknight anchor for WUSA 9. We are so excited to have you join us, Leslie, and now I will turn it over to you.
Beth, thank you so much. And what a great way to move into this National Minority Mental Health Month by having this conversation about the intersection between mental health and obesity. We're going to have a robust conversation for the next hour. It's going to be fantastic. But as Beth said, this really is all about you. And you know, it's really actually pretty hard to get into some physicians now that things are opening up. You wouldn't believe how long you have to wait to get into some appointments. So I'm going to introduce you to our panelists who come with a wide range of experience. And we're going to go through this conversation, but we want you to really ask away. So think about those pressing questions that you might want to ask today and put them in the Q&A function. And we promise we'll get to them once this part of the conversation wraps up. Really delighted to be here, and I'm glad that you made time and space in your day to be with us. So now let me introduce our esteemed panelists. They are phenomenal. First, Dr. Ariana Chow. She is an assistant professor at the University of Pennsylvania School of Nursing and the Perelman School of Medicine. She earned her BSN and her MSN as a family nurse practitioner from Boston College and her PhD in nursing science from Yale University. And she spends a lot of time identifying biobehavioral mechanisms related to binge eating and obesity. She is particularly interested in the role of food reward, food craving, addiction, stress, impulsivity, and how all of this contributes to binge eating disorder and obesity. Dr. Chow's clinical practice, where she practices, she provides medical management for participants enrolled in research studies at the Center for Weight and Eating Disorders. So we welcome you this afternoon, Dr. Chow. So great to see you. Next, we welcome in Dr. Christine Crawford. Dr. Crawford is an associate medical director of the National Alliance on Mental Illness. They are our partners today as we have this conversation. She's an adult and child psychologist based in Boston and an assistant professor of psychiatry at the Boston University Medical School. She's worked in various outpatient community settings where she's got a lot of experience providing psychiatric care to people from diverse backgrounds and a strong passion for using education as a tool for community outreach and engagement. She's authored several book chapters on mental health disparities and socioeconomic issues within psychiatry, as well as made appearances on a number of media outlets discussing various topics around mental health. We welcome you as well, Dr. Crawford. And finally, we round it out with Dr. Timothy Quinn, who we lovingly call Dr. Quinn Medicine Man, right? Joining us from Mississippi. He is a family physician in Richland, Mississippi, dedicated to continuously providing exceptional, consistent, comprehensive, and compassionate and ethical medical care. Dr. Quinn's services are guided by virtues of empathy and mercy and respect for the dignity of every patient. His goal is to meet the varied needs of the people and to care for the mind. And he's also written a book talking about a myriad of different things. He uses effective communication, teaching, and his interpersonal skills to kind of reach through to his patients and impact their healthy lifestyles to make changes to keep them here healthy and thriving. And so we welcome you, Dr. Quinn, as well. We round out this wonderful panel as we get ready to get into a very informative and engaging conversation. Again, start thinking about those questions that you might have for all of our panelists, and we will get to them a little later on. But let's begin really by establishing this connection between obesity and mental health. And Dr. Chow, I want to start with you because I guess the question would be, is it that obesity can negatively impact your mental health, or are people with mental health more likely to develop obesity, or is it both?
Yeah, so this is kind of a chicken or the egg type of question, but the answer really is both. So a number of studies have looked at sort of what comes first, obesity or some sort of mental health condition. And the answer is that it's kind of a bidirectional relationship, that obesity can result in sort of negative mental health issues. Some of the effects of obesity, such as stigma attached to weight status or activity limitations, may be related to obesity, can actually exacerbate or contribute to different psychiatric conditions such as depression or anxiety. At the same time, psychiatric disorders also can result in obesity via maybe the symptoms of the psychiatric condition itself. So, for example, for depression, increased appetite might be a symptom of that, or reduced physical activity, and can also contribute to things like binge eating.
We're going to talk about that a little bit more, but I want to ask Dr. Crawford, building on that answer. So we know that people with obesity, as well as people living with mental illness, experience bias and stigmatization. And we know that this disproportionately impacts people of color. And so I'm wondering if we can talk about the impact that stigma actually has on people's willingness to even seek out treatment if they are experiencing or living with obesity and also living with mental illness.
Absolutely. Stigma is the biggest barrier for people to seek out care, not only for their obesity, but also for any psychiatric symptoms that they may have. What happens with stigma is that people have shame about the condition that they may have, and they have worries about being treated differently by other folks because of the condition that they have. And so the combination of external factors and how people will treat you and how you're feeling internally can really serve as a significant barrier to people getting help. Now, the thing about mental health conditions, especially depression, you're already having negative thoughts about yourself. You may have some feelings of guilt and feelings of not being worthy. And so it's often hard for people to imagine that they are worthy of getting help for their mental health condition and for some challenges that they may have around maintaining a healthy lifestyle. And so it's important to have open and honest conversations with healthcare providers, with friends and family, to normalize conversations around mental health so that the shame that people possess internally doesn't interfere with their ability to get mental health treatment. And the same goes to those who are living with obesity. Talking about it openly, normalizing the fact that treatment is widely available, and to ensure that healthcare providers aren't treating people who are living with obesity differently. And the same goes for not treating people who have mental health conditions differently as well.
That's one of the things that Dr. Quinn, I'm sure you face daily as a practitioner in Mississippi. And I'm curious about what the statistics are about obesity in your state, but also how you handle your patients who come in and may present with symptoms, or they may talk about their lived experience living with obesity, living with mental illness, and having mental health issues. Or how do you even start that conversation if they open the door?
Well, the main thing that we do is try to establish hope. A lot of individuals that are living with obesity, and these include a lot of my patients right now in Mississippi, our percentage is about 40.8. That's higher than the national average. The last I checked, it was 36.5. So we have a higher percentage of people living with obesity, and these include a lot of my patients, my own personal family, and my friends. So what we do is we try to establish hope, because a lot of individuals that are living with obesity might feel that, you know, I'm overweight, I'm living with obesity, and there's really no reason for me to even try to get healthier or even try to take medicine, because this is my fate. And as I keep reiterating, we try to establish hope, and I use examples of other patients to share with my patients. And for instance, one patient, we were able to get her motivated. And we express that losing a small percentage of body weight, maybe 10 to 15%, has a big impact on your health. Case that we use a lot is one of our favorite patients, and we'll just call her Miss Jones. And we helped her over the course of about 12 months. We lost about 40 pounds, and she started out about maybe 210 pounds and got down to about 170. And I remember so well that when she lost the weight, very aggressively, we were exercising every day. We have different programs. She was eating healthy with her dietary diaries. She lost the weight, but then she told me at the end that she's still fat. She used that word, and we don't use that word, and we corrected her right away. But the deal is, we looked at her notes. We looked at her medical record. When she first started this journey, she was on insulin because her diabetes was so poorly controlled, and her hemoglobin A1C, which is a test for how well your diabetes is doing, was about 12. But over the course of the months that she lost the weight, we were able to titrate the insulin down to no insulin at all. And now she was only on pills for her diabetes, just 2 pills, and her hemoglobin A1C was like 7.2. So what we expressed to her was, you lost weight, but you may not have gotten to where you wanted to be physically as far as your appearance, but your health is phenomenal because her kidney enzymes had gone down. I mean, I told her, I said, ma'am, you were on the way to dialysis and possibly death early on had you have not done what you did. So we share this as a motivational tool, and a lot of patients take it and they get it, and they understand that taking this step prolongs their life, and it just does so much for their health. And we're getting a lot of success right here in Mississippi.
You know, Dr. Quinn, I wonder, so Mrs. Jones is clearly a success story and still clearly a work in progress. But
Mhm.
how do you talk with your patients or even start the conversation if they maybe don't have an awareness about this lived experience? If you're noticing something that may be impacting their quality of life, how do you help start a conversation?
Well, what we do is, first of all, we have a very robust campaign. We work very closely with the Mississippi State Department of Health, which is our health department for our state. And we actually have grants where we fulfill these requirements to get the information out there. So we have a lot of a very robust social media. I don't know if everybody's on Facebook, but check us out. It's Dr. Timothy Quinn, Dr. Timothy Quinn, and we have a lot of videos that are very unconventional. A lot of my colleagues initially early on were like, I don't know about this, but we might get on there and just we do a lot of TikTok videos, just fun, and the whole office is dancing, and we have about 20,000 followers now. It's growing every day, but what we do is we get the attention of the people. And once we have their attention, then we give them the information and raise awareness. But we also go to churches. We have a church ministry where we've been to almost every church in this area over the last few years. We slowed it down with the pandemic, but now we're doing it through Zoom. And then we have a ministry where we get on the radio. I do the hip hop medical minute, like, yo, Dr. Quinn, but it's fun. And then I do a lot of local news as well. So usually when patients come to our clinic or approach me at the grocery store or wherever, they're already aware of our campaign, and they usually start the discussion and say, tell me more. And that's when we have our opportunity to give them the information that they really need to put them on the path to being healthier.
That's an exciting thing to hear, that these conversations are happening in your doctor's office. I'm wondering, Dr. Chow, for you, can people, okay, so let's say they've identified that they are living with obesity and they want to make some changes. Can they be living with obesity and have an eating disorder? And what are some of the symptoms that sort of go between the two? If you're sitting here listening today and wondering, is this me? Let's talk about some things that can help people make decisions.
Mm-hmm. Yeah, so this is a really important point, and I think it's a very under-recognized issue, especially among primary care providers, but also for people who are living with obesity, that there is actually eating disorders that can occur across the weight spectrum.
Hmm.
So one of the most common eating disorders that I might see with my patients is binge eating disorder, which consists of people having an unusually large amount of food, which would be more than other people would typically eat in a similar circumstance, and feeling a real loss of control over eating. Oftentimes there's a lot of sort of shame or guilt or feeling like they have to hide this issue, and that those can all be signals that this is something more than sort of a weight issue, that it's kind of a disordered eating behavior. Some individuals might also engage in inappropriate compensatory behavior, so use of laxatives or excessive exercise, which might be classified as bulimia nervosa. But some people think that sort of a lot of their eating behaviors are just because of obesity, but there can be so much more than that, especially if people might have had sort of unhealthy dietary patterns that they have engaged in previously, like a lot of fasting or really rigid restraints about forbidden foods. Those can all be sort of signs that there might be something more, and to seek help from a mental health professional.
Yeah, as we bring Dr. Crawford in to talk about that part of it, I'm wondering, what are some of the physical manifestations you think of some mental health problems like anxiety and depression? What role might they be playing in this?
Absolutely. So, first, talking about depression, one of the classic symptoms of depression are changes in your appetite. And so, for some people, it can mean having diminished appetite, but for a lot of individuals, it can mean an increase in appetite. The other classic symptom that we see is low energy. And so, people who might have previously been active are really tired. They're not sleeping well. They don't have enough energy to do their regular daily activities. So the combination of the increased appetite, the low energy, and also the feelings that I described earlier about the guilt, feeling like a burden, feeling like I'm not really worthwhile, can really have a significant impact on people's ability to engage in various physical activity, or to feel motivated to eat in a nutritious way, and to spend the time to cook and prepare foods rather than seeking out fast food and other options that may not be as healthy. The other thing is generalized anxiety disorder, or any other anxiety disorders that are out there. People can experience fatigue as well. They can have problems with focus and concentration. And we also see people who can experience aches and pains all throughout their body, headaches, they can have stomach aches. And so if you're physically not feeling well and your mind is overwhelmed with all of these worry thoughts that are difficult for you to control when you have anxiety, it really can make it difficult to do all of the things and take all of the necessary steps to ensure that you're able to maintain a healthy weight. The other thing that can complicate some of the situations when it comes to individuals who have mental health conditions and may have some difficulty achieving their ideal weight is that some of our medications can make it such that they can put on weight. However, what I tell my patients as a psychiatrist, as a medical doctor who's prescribing these medications to people, is that your mental health is a direct connection to your physical health. And that's why you have a neck, because the head is connected to the mind. And so if you are burdened with depression and anxiety, the 5 pounds, the 4 pounds, the 3 pounds you may gain with the medication will far outweigh the potential risk of having even higher weight gain if you have untreated mental health conditions. Not only higher weight, but also poor emotional health that can be detrimental not only to you, but also your relationships with your friends and family.
So we are all living through this pandemic together. And, almost a year and a half later, this has really taken a toll on most Americans. And while not everyone may be able to say that they are living with depression or obesity, there are folks who may be feeling as if they have some additional anxiety and concern. Some people may be turning to food for comfort during this time. If you're just starting to wonder, I don't know if I'm making it so good right here. I'm not feeling so good. I've never been diagnosed with anything, but I'm feeling a little concerned. I'm feeling a little overburdened. This pandemic has gone on for a long time. It's disrupted my life. And I know that there are a lot of people who are experiencing this. All of us have experienced this, quite honestly. What do you do? Where do you start? If you're just wondering, what do I do? This one's for you, Dr. Crawford.
So it's interesting because I paused for a little bit, and as a psychiatrist, I'm very comfortable with silence and pauses and to give space for other people to jump in. But what I tell some of the people that I interact with outside of my psychiatry clinic is that your primary care physician, your primary care provider is a really great resource to start off with. And that's why I was looking over at Dr. Quinn, because we often refer people to talk to their family medicine physician or other primary care docs. The reason for that is that when people think about navigating the mental health system, they think to themselves, this is too overwhelming. I don't know where to begin. They're told to look at the back of their insurance card and call the number for behavioral health, and perhaps the insurance company will guide them in the direction of a provider who is accepting their insurance. But if you're already feeling anxious, if you're already feeling depressed, it can really require a lot of energy to take all of those steps to figure out who to call, what to ask for, wondering if your insurance will provide that coverage, and not knowing whether or not you need to start off with a psychiatrist like myself or with a therapist, a psychologist, a counselor. And so talking to someone that you already know, who already knows your history and what you've been going through, they can help guide you in the right path for what sort of treatment would be good for you. Now, there are a lot of communities in which there, unfortunately, are limited resources or limited access to mental health providers. And there are a lot of primary care providers who are able to tend to some of the mental health needs, whether that be medications or they may be therapists who work within the community health center that their primary care provider is associated with. And then there are a number of us as psychiatrists who have direct connections and relationships with primary care providers to give them advice or recommendations for patients that they're seeing in their own clinic who may present with some mental health challenges and need to do a consult so that they can get some information on the right medication. So in summary, Dr. Quinn and someone like Dr. Quinn is really a great place to start.
And that's a great place to go next. Dr. Quinn, you kind of gave us a little bit of an overview of the rates of obesity in Mississippi and how they compare nationally. But I wonder, in your practice, how is this showing up in your practice beyond just the example that you gave us of Miss Jones? Have you seen an increase in patients who are seeking you out for help navigating a mental illness or navigating obesity? What's happening now in this COVID environment?
Most definitely. And usually it's not as clear as someone coming in saying, hey, I'm depressed, or hey, I have anxiety. Normally the way it works, and Dr. Crawford is so right on point about it. A lot of individuals that come in, as a family physician, we have specialized training to identify what we call warning signs. Decreased eye contact, fidgeting. Maybe their hygiene is not what it normally is. For instance, I had a lady yesterday and she came in and she did not have on any makeup and her hair was sort of disheveled and she had on clothes. This lady is always immaculate. I mean, she's just a firefly lady. And when I walked in the room and I spoke to her. I said, hey, how you doing? Mrs. And basically she just looked down and she didn't say much. And I knew right then that it was time to go into action because she was suffering. And it turned out, I went through the necessary questions and she was suffering from acute depression. And a lot of it had to do with the fact that, she had lost her job because she had a problem with childcare and a lot of the common problems that are going on right now with a lot of individuals dealing with this pandemic. But the take home was I was able to talk to her and we got her, we made a phone call and we were able to get an appointment today with a psychiatrist, believe it or not. It's very, and like Dr. Crawford said, there is quite a limit for psychiatrists, especially in a lot of communities, especially Mississippi. We have a very low provider to patient ratio in this state. We're unfortunate for that. But the take home is the primary care provider, just because of the familiarity, we've been in practice for 18 years. So we've been to a lot of these patients' churches. They see us at the grocery store. They feel more comfortable. But not only that, for those that come in and they don't just say they have depression or anxiety, we do have the training to recognize those warning signs and do the necessary questioning and get them the help that they need.
That's really important. As we talk about obesity, we know that there isn't one thing that contributes to obesity. It's a continuum, it's a spectrum. And today we're, of course, talking about the food connection and also mental health. I wonder, Dr. Chow, you've spent a great deal of your career analyzing behavior, researching behavior. As we start to think about building healthy body images and building healthy habits, What is some advice that you can give us that everyone can benefit from? You're highly specialized, and so the likelihood that the person watching now would make it to your office immediately is probably a little unlikely. They might get to Dr. Quinn first. They might get to Dr. Crawford. If there's a heightened awareness, they're probably making it to you, and you're doing research. Can we talk a bit more about the role that behavior plays in obesity and this connection between mental health?
Sure. So one of the common things that I have noticed sometimes that can make a big influence in the obesity and mental health connection is how we're really evaluating ourselves and our own body image. So body image can have a huge role in terms of our self-esteem as well as our quality of life. And oftentimes, because of different sort of cultural things going on in terms of social media, in terms of how our culture really emphasizes this really thin ideal, we can sort of be having these negative self thoughts about ourselves and kind of speaking very unkindly to ourselves, which can weigh a lot on people's self-esteem and just how they go about their everyday lives. So as much as possible, I try to emphasize to people to really try to stop the negative self-talk, to shut down sort of the voices in your head that might be telling you that your body's not the right size, or maybe that you're a bad person because you might be struggling with a weight. One of the really important things that I also emphasize to people is really to treat yourself with the same kindness that you would treat, say, your best friend or your child. Is this how you would talk to them? Yes or no? If not, maybe to reevaluate sort of how you're reflecting upon yourself. Some of the strategies in order to do this are really sort of making sure that in terms of like looking at maybe yourself in the mirror, a lot of times people might be hyper focused on a specific part of their body that they don't like. So I try to help people to develop a more neutral sort of opinion about that part of their body and to focus more on those things that they like about themselves, to write down some positive self-affirmations about themselves. It sounds really corny and cheesy, but it can be really helpful to kind of put them on a list. And then anytime you're recognizing that, I'm not really being very kind to myself, to go ahead and to refer to those. Other things are to kind of make sure that you're being a critical sort of consumer of social media and recognizing that sometimes most advertisements and sort of billboards that are put up are sort of airbrushed and not necessarily true depictions of what people's bodies actually look like in real life.
Which is interesting. And even now, when you walk around, as you look at some of the billboards now, you can see some of the companies are saying no filters, that they're actually going with a more authentic view of who we are in the moment. While I have you, and because you've done so much work on behavior, I have to ask, and I know that food is not the only contributor to obesity, but as we talk about obesity, is there something that we can do to regulate our brains, to control cravings, to control appetite? And that is just a fascinating place. And I know all of us have food cravings, right? We wake up every day. Some people maybe want something sweet. Maybe some people want something salty. All of us have dealt with food cravings. It's a human thing. And we've been dealing with this since the beginning of time. But can you talk a little bit about if there's something we can do to change the way we're thinking about these cravings and behavior, and whether that could make a difference in living with obesity and also navigating mental health?
Sure, definitely. So in terms of things like food cravings, most people do experience them, as you said. Almost all adults have had a food craving at least once in the past month. A lot of times people don't realize that they don't need to give into the food craving all of the time. And a lot of times these cravings are actually a result of how our body is perceiving different stimuli around us. So for example, when people go to the movie theater, they tend to crave popcorn because we've been conditioned to have that sort of response over time. So kind of realizing that you can sort of dispair these cues and not give into the food cravings is really important. Same thing with, we talked a lot about how people are having a lot more stress and emotionally eating. And realizing that stress can actually be a real trigger to have different sort of cravings. Our body, when we're stressed, releases things like cortisol, which actually drives our preferences for these high energy density foods. because stress is really a response that's teaching us to sort of fight or flight a different stressor in our environment because we see it as very challenging to us. So with sort of cortisol and different sort of hormones going on in this sort of drive, sort of recognizing that there's different sort of healthier coping mechanisms that we can develop to respond to sort of different stressors or things going on aside from giving into cravings or whatever sort of food that we're used to coping with is something really important. And this could take the form of sort of trying to reduce the stressors when possible. So, evaluating whether this is a really urgent task that I'm doing right now or if it's something I can delegate or, drop off. And also engaging in different sort of healthy stress reduction activities, such as physical activity, yoga, mindfulness. And those can all be really helpful things to manage stressors that are occurring in our life.
That's really important information, Dr. Chow. I just want to invite everyone. Thank you again for being here and participating in this conversation. We're going to get to your questions soon. You can still put your Q&A questions in. You just scroll just below where you see us. You'll see an opportunity to put questions in. We want to get them to you because this afternoon is really about you. I'm going to shift a little bit over to Dr. Crawford now. We're starting to spend more time with our families. We're starting to spend more time with friends as people are getting vaccinated and feeling a little more comfortable. And we may be noticing patterns or behavior or things that seem different. And I wonder, how do we have sensitive conversations with the ones we love if we're sensing that there may be some mental health related issues that they might want to address? How do we start those conversations? Should we start those conversations with the ones we love?
Leslie, this is a fantastic question because reemerging from the pandemic and returning back to our usual social lives will be a great thing for a lot of people. But there's going to be a percentage of folks in which the transition back to our social lives will be quite the challenge because the pandemic affected them in a difficult way. And for a lot of people, it's hard to be open and honest about what it is you're actually going through and what you've been through, and to share that with people who are close to you. And so oftentimes when we reconnect with people, we ask the question, how are you doing? We're not really used to getting a long-winded response. We're usually used to hearing oh, I'm doing fine, or it's okay. But I really encourage people now, when you are reconnecting with coworkers because you're returning back to work, or you're reconnecting with elderly family members, to really mean it when you're asking the question how you're doing, and convey to the person that you really want to know. So if you ask the question, how are you doing? They give you a one-worded response. You can then invite further conversation and further discussion by sharing with them how you are actually doing. And to start the conversation with saying things have been tough with me. Coming back to work, that's really been hard for me to be away from my children after being with them for almost over a year and a half. By sharing with other people what you're going through, again, is a way to further normalize the discussion. And perhaps it plants the seed in that person's head that they are not alone in going through what it is they're experiencing emotionally, whether that's feeling anger, feeling irritable, feeling sad or anxious. Knowing that there's someone else that's going through that may make it easier for them to open up and share at some point in time in the future. It's all about planting these seeds, and having conversations is one way to start that process.
You talk about reemergence, and I have heard from some people that are pretty nervous about going back into the workplace because they feel like they've gained a lot of weight. And so in some ways, it's not always the anxiety that some people are wrestling with. It's the body image as well. And we may not fully appreciate how that presents itself in people as we navigate this really unprecedented challenge as a nation and a world. I wonder, Dr. Quinn, has that come up at all with any of your patients? Have they said, in addition to not really wanting to go back because I may have some anxiety, I'm also concerned about who I am now. And I'm not sure that I'm okay with going into a workplace right now.
Right. And like Dr. Crawford was saying, it all starts with the conversation. And these conversations are so critical. And you know, if you're a family member talking to another family member, or a person talking to their friend, or a family doctor or a psychiatrist or a psychologist speaking with a patient, showing vulnerability helps. It helps a lot because it causes that person to bring down some of those walls, and you say, look, you know, this pandemic, it's been tough for me. You know, I'm a gym guy. I'm in the gym like crazy. Okay, that's my thing. And there was a point when the gym closed, and my wife and I was going into panic mode, but we purchased some gym equipment, but it wasn't a full gym. But I share that with my patients that, hey man, I've been having a tough time as well, because during the pandemic I wasn't able to work out like I normally do, and I got to get back on it. But you know, the most important thing is to have that conversation and open up that dialogue, and then that way you can help a person get through it. But and I just reiterate, it really helps if you can let them know how you struggled as well, and then they feel more comfortable to discuss how they struggled, and then you can better help them because you have more insight on what's really going on.
So we've got about 5 more minutes to talk amongst ourselves. And I want to ask all of you the exact same question before we open it up to our wonderful people who've joined us this afternoon. And that would be, what is the first step someone should take if they're concerned about their weight in relation to their mental health or vice versa? And we'll start with you, Dr. Chow.
Yeah, I would say to reach out to their primary care provider and sort of make sure that they're being evaluated to get the right sort of treatment at the right time. So we know that in general for psychiatric conditions, if the symptoms are very severe, that they can be a real challenge and present some barriers to weight loss over time. So making sure that sort of they're getting the appropriate and right treatment, I would say would be the first step.
Dr. Crawford?
Yeah. And what I would say too, if you recognize that you do need some help and support, to lean into the treatment, to lean into the help, because oftentimes we're so used to thinking to ourselves, I can get myself out of this if I just pray on it, if I pull myself up by the bootstraps, I should be able to overcome. But being a good person to yourself, it's knowing when to reach out and to get the professional help and support that you need. Even if it's not professional help, just by reaching out to a friend or family member and say, hey, I'm having some challenges here. Can you help support me? That's you taking good care of yourself. It doesn't always have to be about being strong and overcoming and powering through. It's about knowing when to reach out and get help.
I'm glad you mentioned that, Dr. Crawford, because, in many of our communities, people say, well, we'll just go pray it away. We can pray it away. It's going to go away. Dr. Quinn, you're in the Bible Belt, so you know about all of this. I wonder what your thoughts are as well. First step to take if people are concerned about their weight or their mental health and vice versa.
Right. And I'm so glad you brought that up, because Mississippi is, we are a very strong faith-based state, and we very strong about our religious convictions. But what I tell my patients is, in regards to the, I'm just going to pray about it, it's going to be all right. I really express to my patients that God is alive today, and I'm not ashamed to share my faith, and I'm very proud to share my faith with my patients, and I let them know that God uses people and technology in the form of doctors, psychiatrists, general doctors, and psychologists, psychiatrists, but he also, in some cases, people need medication. And the medication is nothing more than God's tools to help us so that we can get better, but we have to use them. And I don't discourage my patients from speaking with their family and also their pastors if that's their comfort level. I work very closely with the city of Jackson, which is the capital of Mississippi. And we actually have a program where we have pastors that are trained to triage patients and listen to their histories and know when to refer to a psychiatrist or a psychologist. So the bottom line is the most important thing is to emphasize to patients to get help. There's nothing wrong with it. There's everything right about it. And plus, as Dr. Crawford and Dr. Cho said, because you deserve it.
Absolutely. Absolutely. I'm so glad that we ended this part of the segment with saying you deserve it, because it means that you honor the place in you, that you are deserve to walk on this earth and be healthy and be thriving and not simply existing. And if that's the only thing that you take away from this afternoon, that would be significant, because hopefully it would spur you and inspire you to take action because you're worth it. Thank you all so much for this part of the journey. Now we got a lot of questions to get to, so I'm going to keep them moving because they are really, really good. The first one is, can you all talk about treating patients with pharmacotherapies and managing patients who suffer with obesity and mental health issues? And we talked about this a little bit. Some people had some hesitation because they were concerned about whether it would impact their weight disproportionately, and they may already be dealing with that. But Dr. Chow, any thoughts about that?
Sure. So there are a lot of different medications available. In terms of the psychological pharmacotherapies, some have different weight gain potential. So it's always helpful, I think, to start that conversation with your provider about if there are, like, how much weight you might expect to gain from this, and also what you can do at that time. In general, when people are starting pharmacotherapies, which might be necessary for controlling their mental health symptoms, but might also have sort of a high risk for weight gain, studies have shown that actually lifestyle intervention, making sure that people are self-monitoring their food, engaging in physical activity, eating a healthy diet, really can help to counter those sort of effects over time. The other thing in terms of obesity pharmacotherapies, there are some different ones that can be started right alongside a psychological pharmacotherapy if someone is gaining weight over time. So some of the different medications also can help to manage different sort of psychological conditions as well, like depression, that are also used for obesity.
Dr. Chow, this is another sort of follow-up for you. And then Dr. Quinn, I'd like you to take this on as well, because I know you've written about this. People are wondering about techniques to overcome emotional eating.
Yes. So there's a number of different techniques. I think it depends on identifying what your stressors are. So in general, when I start working with patients who are struggling with emotional eating, I start working with them by having them sort of first self-monitor and record sort of what they're eating and then what sort of emotions are going on at the time, so that way we can identify different sort of triggers that might be related to emotional eating. Different sort of coping skills strategies are also really important. So developing some different sort of alternatives that you can do when you are feeling really emotional or having a lot of stress or feeling really depressed or lonely are also important things.
Dr. Quinn?
Yes, we use a lot of those same techniques with our patients, and I have written about that extensively in my book, and I also do a lot of counseling on that. But really, those substitutions of those emotional foods, you know, we one thing we do is we have to help the patients understand that they have to be aware, because in a lot of cases people do emotional eating and they're not aware that they're doing it. So one thing that's been very beneficial for our patients is we get them to journal. And we're actually in the process of working with the Mississippi State Department of Health, where we're creating an app where you'll journal what you eat. It's like a food diary every day. You know, when you eat it, at what time and whatnot, and then there'll be a counseling session, but we'll use that. And at that time, we would ask them how they felt when they did it, but we would also help them to realize that you can substitute these foods with either some other activity or healthier foods. But, and I reemphasize, the most important thing is you have to help patients become aware, because as I said, many people emotionally eat and they don't realize that they're doing it.
That's interesting. Dr. Crawford, there are a number of questions that people have a heightened awareness about the role that racism plays in obesity and mental health. And they're wondering if you can talk a bit about how that impacts Black women and Black men specifically.
Absolutely, because we know that racism is alive and well in this country and that it is fully present and that it's a constant experience for a lot of people of color, especially Black people, and particularly Black women too, who have the added burden of this double minority status of being Black and being a woman, and some of the discrimination that's associated with that. Racism is a known form of trauma, and experiencing forms of racism like microaggressions, which are these subtle put downs, these sly comments that people make, such as, "Oh, you speak well for a Black person," or, "Oh, you're pretty for someone like you," or, "I'm surprised that you're in this position," makes you wonder whether or not you fully belong. And it's a way that it kind of chips away at your sense of self-worth and sense of belonging. And to experience that day in and day out can erode at your physical and psychological well-being. Being Black in America is almost like wearing a sticky suit, where these microaggressions, they stick with you and they build up over time. Or when you're going out to the store, you're being followed or you're being pulled over by the police and it doesn't seem to be appropriate for the reason as to why they're doing that. All these aren't little things, but all of these interactions really can weigh down on you, can result in significant trauma, and has been associated with symptoms such as depression, such as anxiety. And for some people, we can also see some symptoms of PTSD or post traumatic stress disorder, where you're often triggered by hearing about reports in the news, on TV, on the internet of Black people experiencing racism, or even our other people from other minority groups, especially the AAPI community. When you hear negative things happening to your people, racism happening to them, it can trigger that fight or flight response that Dr. Chow had connected to earlier on, in which you have this heightened sense of awareness. It creates stress on your body and can really take a toll on your emotional well-being. The other thing too about racism, I'll just say quickly, is that it can also be a barrier to feeling comfortable meeting with a mental health provider, meeting with a therapist, meeting with a psychiatrist, because there could be a sense of distrust that the person of color may have with their provider, and also a sense of concern that they may not fully appreciate their life experience and how racism really plays a role in all of that, and have concerns that the mental health provider may minimize the role of racism. So it really gets in the way of seeking out treatment, and it can have a direct impact on people's physical and emotional well-being.
I've heard all of you as experts talk about stress and the role stress plays in both obesity and our mental health. And we have a question from someone who says, does a stressful home life prevent weight loss? Dr. Quinn, do you want to start with that? Have you ever been confronted with that in your practice? Does someone say, I'm feeling really stressed at home and I don't know what to do, and could this be impacting me and my journey living with obesity?
Most definitely. I have a great deal of patients that are living with obesity, and a lot of these patients may be single mothers or even single fathers. I have a few of those, not as many, but the bottom line is a lot of these patients have additional stressors. And a lot of these stressors include the responsibility of caring for their children without adequate support. I have a lot of older patients that have children that are in their 20s, and they're coming back home and they're very disruptive. Some of these younger children are not working. I had one lady whose son was selling drugs from her home, and she was living with obesity as well. But every patient that I get, I try to get them to strive to be healthier, to adapt healthier lifestyle choices, because I'm a family doctor and I treat the psychological health of my patients, the mental health, but I also treat the medical health as well. And a lot of these patients have diabetes, they have high blood pressure, heart disease, kidney disease. So my job is to try to help the whole person physically and mentally. But a lot of these patients that are living with stressors, it's harder for them to adapt these positive lifestyle choices, because as Dr. Crawford and Dr. Cho spoke of earlier, a lot of them do stress eating because of the enhanced levels of cortisol or these stress hormones in their body. It causes them to eat more, and then it just sort of gives them somewhat of a soothing of the anxiety. But also the cortisol or some of the other stress hormones as well can cause what's called insulin resistance. So if this is someone that's pre-diabetic or someone who has diabetes, their state of their disease will be exacerbated or made worse. So now they're getting more unhealthy, they're gaining more weight. So that's why this discussions such as this are so important and so beneficial, because mental health needs to be increased in awareness, and also aggressively pursued by so many people, including the medical field, but also, as we were talking about, people just checking on family members and seeing where they are and advising them to seek help, but also dispelling a lot of the negative stigmas associated with seeking mental health, and letting people know that it's not turning your back on your religion, but it's embracing your religion, recognizing that it's something that is helpful and it's a tool, but also lastly, to reemphasize that they deserve it. And I just really like that a lot, because as Dr. Crawford and Dr. Cho was saying, a lot of times because of racism, people living with obesity, or just being treated different than everybody else in a negative way, sometimes people can get a sense of lower self-worth, like they don't deserve it. But what we have to do is make them understand that they do deserve it, and encourage them to seek out that help so they can get better.
This is a question that I see here. We talked about it a little bit earlier, but this is a question from somebody who is listening right now. And the question is, how do I talk to my family member about her obesity without harming feelings? I've attempted to do so and have feedback that this is hurtful. It's a tough conversation to have, isn't it?
Mm-hmm. Most definitely, but I advise that person to talk to them about their overweight status, but make it a conversation where they're a part of the solution. And when I talk to a lot of my husbands that might complain that their wives may have gained weight, I say, don't go home and do it like that, because you'll probably be sleeping out in the parking lot out there. But a better way to do it is say, let's get healthier. Let's start eating healthy. Let's go walking every day together. And let's do this. And usually when a person approaches someone and owns to be part of the solution, they're received better and there's more success. And in the end, everyone wins.
Dr. Crawford and Dr. Chow, we're rounding this out. I want to get you in really, really quickly. Dr. Crawford, I think it might be great to have you weigh in on that same question.
Yeah, so I appreciate Dr. Quinn's response, because having the person be part of the solution is helpful, rather than telling them what it is that they need to do and what it is that they're not doing and what they're doing wrong. When we come at it from a negative standpoint and saying, you're not doing this, this is wrong, that's not going to uplift the person to feel motivated in order to make the change. I also I think it would be helpful to come from a stance of curiosity rather than problem solving. And so one could approach the family member and say, I've noticed that there have been some changes in the fact that you're not as active as you used to be. I wonder, how have you been doing? And I wonder about that change. So coming from a place of curiosity invites a conversation about what's going on. And maybe that family member will say, and because I haven't been as active, I've gained some weight and I'm not feeling good about it. And then that's a great time to align with that person and to work together to see how you can best support them.
That's a great way to handle that. We've got one last question, and Dr. Chow, I think this one might be for you. We talked about obesity therapies, pharmacotherapies, but there's a question about this and getting more access to them, because this person writes that right now Medicare and some Medicaid programs do not provide coverage. So how do you get around that?
Yeah, so there's a lot of different challenges with having obesity pharmacotherapies being prescribed. There are some that are a bit that have been around longer that insurances tend to cover. However, it's really important, I think, that all of us are calling our senators, our policymakers, and really advocating for coverage of these, because that's oftentimes how the laws are passed, is kind of from hearing from the constituent and kind of voicing our concerns about the need for these things to be covered.
Well, Dr. Chow, Dr. Crawford, Dr. Quinn, thank you all so very much for your time, for your talents, but mostly for your heart this afternoon, and for sharing that with all of the people who have gathered to listen to you, to seek counsel today, and hopefully to make a plan that makes their lives healthier, better, and they can thrive past this hour that they have spent with us today. On behalf of the Black Women's Health Imperative, healthywomen.org, and the National Alliance on Mental Illness, we thank you for joining us today. We truly appreciate you, and we hope that you leave here informed, inspired, and thinking about how to make a difference in your life and the lives of the people that you love. We also invite you to visit reclaimyourwellness.org for additional resources on obesity, and to view the recording of this webinar, as well as the other webinars and podcasts on obesity. We have to thank again our incredible panelists, Dr. Ariana Chow, Dr. Christina Crawford, and Dr. Timothy Quinn, Medicine Man. We've been saying this, Medicine Man. And finally, of course, we could not do this without the support of Novo Nordisk. And so we thank you all for your support of this webinar. Thank you again to everyone, and have a wonderful day.